The Rasmussen Center concept is that heart attacks and strokes are a consequence of progression of early disease. That disease is in the arteries and in the heart. And if you can identify the early phases of the disease and slow its progression, you can greatly reduce the risk of heart attacks and strokes. So our approach is to individualize the identification of early disease. We see patients every day in the Rasmussen Center, and we're delighted to welcome people who have some concern about their cardiovascular health. The screening at Rasmussen includes the measurement of function and structure changes in the arteries and in the heart. It requires 10 tests that can be accomplished in 1 hour, and those 10 tests define whether the arteries and the heart are healthy as they should be for the age of the individual and gender of the individual, or whether they're showing signs of early disease that could progress, that would put the patient at a risk for a future heart attack and stroke. The testing that we do in the Rasmussen Center leads to a score which relates to the severity of early disease. That score can be anywhere from 0, meaning no disease, to 20, meaning that all 10 tests of cardiovascular health are abnormal. People whose scores are 0, 1, or 2, we believe are essentially normal and should need no intervention, no drug therapy to reduce their risk. Those with scores of 3, 4, or 5 have what we call early disease, in which lifestyle changes should be introduced to slow its progression. Those with scores of 6 or above have advancing disease, which we've identified to be associated with a high risk for future cardiovascular morbid events, such as heart attacks and strokes. So we have an actual scoring system which defines the severity of disease, and everyone should know their score and know whether they themselves are at risk. The state of Minnesota has been a leader in preventive medicine, and this is really a remarkably innovative program that puts the University of Minnesota in the unique position of being a leader now in the new era of individualized cardiovascular disease prevention. Our approach: bring people in, screen them, identify whether they do or do not have early disease, and then treat that early disease with interventions that can favorably affect its progression. That's the future of cardiovascular disease prevention.